All right, good evening, everybody. Hope you're doing well. Good to have you here on the Wellness 360. It's a channel where we learn a lot about our health, stay healthy, and then improve stay well, because obviously without health, nothing is possible. Your health is indeed your most important asset, and it's always important that we protect it with our lives. Literally, yes, we need to protect our health with our lives. And so I thank you for joining me here on the Wellness 360 with myself, Dr. Kelvin. Let me just fix this technical thing quickly. Good. Yeah, now I'm not too far away. All right, good to have you here. So we are doing this live on YouTube, as you can see, and on Twitter Spaces as well. So you can just quickly dash to Twitter or YouTube and quickly share this as well. Let's invite people to join us so that we can have a good session together. But we are going to go ahead anyway. Those of you who join in the replay, would love to hear from you as well. If you are joining me live, again, I'd love to hear from you. Let me know where you're joining us from, and type your name and type your location. It'll be good to know who's with me here on this call. Thank you very much for being here. Now, my name is Kelvin. I'm a medical doctor. I am your wellness consultant, which means your health is my topmost priority. And this is my channel, so do subscribe, do follow, and let's build this community together. And as I said earlier, your health is indeed your most important asset, because without health, what is money? you need health to chase money, and you kind of need money to promote health as well. So the two are mutually intertwined. So it's obviously important that whilst we have the ability, we protect our health so that it will guarantee that tomorrow we can go out there and push to make some more money. Let's not focus only on the money and ignore our health, because we need our health to make more money. All right, now, so let's do this. We are talking about diabetes and you. And why is it important to talk about diabetes at this point? Is because this month is indeed the Diabetes Awareness Month. And so we are going all out to spread information, to share some knowledge about diabetes, so that we can improve our knowledge about diabetes, number one, very important, so that we can get people to also screen for diabetes, because it's one of those diseases that you can ignore. Most people actually ignore until it's too late. And right off the bat, let me tell you that diabetes is the leading cause of non-traumatic amputations of the lower limb. In other words, the biggest reason for people's leg being cut off when they have not been involved in any accident is actually because of diabetes. So it's a big deal. Now, if you live in Ghana, where I live, and you see how difficult it is, how our buildings are not disability friendly, how our livelihoods are so impacted with when things when you lose your health. Losing a leg is not something that we want to experience. You see, so it's not surprising that a lot of people actually have died with their legs intact, from diabetes. So we want to, as much as possible, prevent that diabetes from setting in. Or if the diabetes does set in, we want to catch it early so we can prevent the complications from developing. Because apart from you losing your leg, diabetes will also cause you to go blind. It's about the third leading cause of blindness. So it's important that we deal with that with diabetes. It's a disease that affects every part of your body. And it's also a risk factor for developing certain cancers as well, because diabetes can also affect your immune system. And once your immune system is affected, your ability to remove cells that are becoming cancerous. The immune system plays a role in getting rid of some cancer cells. So when the immune system is affected, or your immune system is inhibited, it leads to you developing diabetes. Leads to you developing cancer more likely. So diabetes does cause that as well. So it's it's one of those diseases that everybody needs to be testing themselves for periodically, especially if you are a black person like I am. You see, because there's a disproportionately large number of black people who are diabetic, which suggests that there is a genetic predisposition. So if you are black, you should be paying more attention to your blood sugar, than the other races, even though overall all of us need to be paying attention to our blood sugar. So let's quickly dive in. So now, what is diabetes? So So like I said, do share this and let's invite people to join us as well. If you're on Twitter, you're welcome. Good to have you here. Lovely to have all of you here joining us on Twitter, and then all of you on YouTube. So good to have you here as well. You can drop your questions and feedback as we go along. If you can hear me loud and clear, please drop your name and drop where you're joining us from. I'd love to see who's here with me. Thank you very much. But we are going to make progress. So as I said, now what is diabetes? Diabetes, essentially, I mean, if you come to the local language, almost every local translation of diabetes calls it the sugar disease. You know, so almost every local translation calls it the sugar disease, which interestingly, it's not that you don't have sugar in your blood. It's actually that you have too much sugar in your blood. And the reason why you have too much sugar in your blood is because the mechanism, the systems that would have taken care, that would have pushed the sugar from the blood into the cells where they are needed. So understand this. Sugar is the most important fuel that your body actually uses. Without sugar, your body would actually capitulate. You die, without sugar. Marcus, good to have you joining us all the way from Jamaica. Wow, good to have you. All right, so without sugar, your body cannot survive. Sugar is what drives. It's kind of like the fuel, the petrol that you put in your car to get your car moving. That's sugar. So sugar does that for your body. Now, without the sugar in the cells, the sugar is useless. It's kind of like you have the fuel in the tank at the fuel station, and then you are on the highway going from Accra to Kumasi or New York to Pennsylvania. You need the fuel inside your fuel tank for the fuel to be useful to your car. If the fuel stays in the fuel station, it doesn't help your car to move. So when fuel stays in the blood, it is useless to the body. The fuel, which is the sugar, needs to move from the blood into the cell. It's the cell that is going to use the sugar to convert the sugar to energy for the body to utilize that energy and make the most of whatever it is that you wanted to do. So diabetes is a challenge for the body in the sense that the sugar is unable to move from the blood into the cell. And the reason why the sugar is not able to move from the blood into the cell is because of two things. And that's how we have the different kinds of diabetes. Type 1 diabetes, insulin production is non-existent. The pancreas is supposed to produce insulin, and insulin is the vehicle that carries the sugar from the blood into the cell. So when there's no insulin, your body is not able to move the sugar from the blood into the cells, and so the sugar stays in the blood, and we'll talk about the complications a little later, but that's type 1. In type 2 diabetes, there is insulin. In fact, in a lot of type 2 diabetics, the body is producing a lot more insulin than normal. But the challenge is that the insulin is not working as it's supposed to work. So it's created, there's a situation called insulin resistance. So this insulin resistance means that something is preventing the insulin. So the insulin is trying to push the sugar out, but something is blocking the insulin from working. So ultimately, the end result is that the sugar is unable to enter the blood and enter the cells, and it stays in the blood. And that creates the problems you're going to talk about a little shortly. So basically, that is diabetes in a nutshell. So type 1 diabetes, the pancreas is unable to produce insulin, and so your sugar stays in the blood instead of going into the cells. In type 2 diabetes, insulin is being produced, but unfortunately, the insulin is not able to function properly. So not enough sugar is going into the cells, and so the sugar, a lot of it stays in the blood, and that's where it exerts its complications, which again we'll talk about pretty shortly. Now, if this is clear, give me a hi, give me a hello, give me a heart in the comment section. Let me know on Twitter as well if this explanation so far is clear. If you have any question at this point, feel free to drop it as well so that we can address it and then get the show going. But whilst you're waiting for your feedback, let's make progress. Now, when the sugar levels in the blood keeps increasing, the challenge, or the result is that the body also begins to respond a certain way, which leads to the signs and symptoms of diabetes. So the most common signs and symptoms of diabetes, there are actually three. It's a triad, which is polyuria, which means you are urinating a lot; polydipsia, which means you get very thirsty very often; and then polyphagia, which means you are eating a lot. Now, I'm sure when I'm done with this explanation, you understand why this triad is so. So medically, or in the medical community, diabetes is described as starvation in the midst of plenty. In other words, it's not that the fuel is not available. There's a lot of fuel at the fuel station, right? But that fuel is not getting into the car. And so you have run out of fuel on the highway. So even though there's a lot of fuel, in fact, there's a lot of cheap fuel. Let me put it that way. There's a lot of cheap fuel available at the fuel station. Because it's not getting into the car, you run out of fuel and you are stuck on the highway. So you are starving, even though there's a lot of food around. So that's diabetes. Now, because the food or the fuel is not getting into the cells continue to give off signals to the brain, telling the brain that, look, we need fuel. And the only way the fuel can get into the body is for the brain to tell the stomach to signal you that you are hungry, so go and eat. You get it? Because your cells cannot get fuel, the message they send to the brain is that we are not getting fuel. It means the fuel level is low, so we need fuel. So get the stomach to bring us fuel. So the signal to the stomach is you are hungry, so start grumbling. So the stomach starts making noise. And then you as a person, once your stomach starts making noise, what do? You get up and then go and get food, so you eat, right? But then you compound the situation because there's already sugar in the blood, and you are bringing in more sugar. So the sugar gets into the blood, and then it adds up to it. So your sugar continues to increase, but the sugar is not getting to the cells. So the cells keep sending signals to the brain, and so you continue to eat a lot, and that's polyphagia. So your response to the lack of fuel for the cells is to eat more. So that's why people with diabetes tend to eat a lot more. So that's the explanation for polyphagia. If it's clear, let me know. We are going on to the next one. Now, unfortunately, because this fuel is still not getting to the cells and the cells are still crying for more energy, they begin to break down your fat reserves. You know, fat is a store of energy. So the energy that the food you consumed yesterday that you didn't eat is going to be stored as fat. And so that when you are hungry or when you are in a period of fasting, right, your body can go back and break down this fat to convert it back to glucose to use. And so because even though you have a lot of glucose available in your bloodstream, it's not available to the cells, so you begin to break down your fat. So people with diabetes eat a lot, but they tend to lose weight. So anybody who is eating a lot and unintentionally losing weight needs to be screened for diabetes because of what I've just explained. And it makes a lot of sense. I'm trying to break it down to the basics as much as possible. Kabna Sapon has a feedback for me. First time I've really understood the difference between type 1 and type 2. Wow, thank you very much for that. All right, now, so that explains the polyphagia, eating a lot and losing weight, which is very typical of especially the early signs and symptoms of diabetes. Then another symptom, your kidneys. Now, your kidneys regulate how much your water balance in a sense of in a way, right? It maintains your water balance and also your solutes. Solutes are your salts and your sugars, right? So when the sugar levels begin to go up, some of the sugar would be excreted through urine. So in the old days, actually, diabetes, and I'm happy I'm not part of the old days of being doctors, because the way diabetes was diagnosed was that the doctor would have to taste your urine. So they'll literally take a glass of your urine and take a take a sip of it, and if it tasted sweet, then you had diabetes. And so that's it. The sugar will cross into the urine, right? And so your urine actually becomes concentrated with glucose. Now, from our basic science or general science way back in the day, when a place has a higher concentration of solutes, in this case sugar, by osmosis, it's going to draw water inside as well. So people with diabetes tend to pee a lot of urine, and they pee frequently. So every time they get up to go and pee, it's a lot of urine. So they are peeing like 4, 5, 6, sometimes up to 10 times even in the night. And each time they go to pee, a lot of urine is actually peed out. And it's because of the increasing sugar concentration inside the urine, which is pulling water by osmosis. And because of this increasing urination, they also tend to get thirsty. So they drink a lot of water. So now you understand the triad, where you are urinating a lot, you are drinking a lot of water, and you are eating a lot, but ultimately you are losing weight. So these symptoms are the classic triad of diabetes. And so anybody experiencing these symptoms needs to be screened for diabetes immediately. And if indeed the person is diabetic, then we do something about it. Of course, diabetes is not the only thing that can cause these symptoms. That's why we need to screen first. We can't just see the symptoms and then start treating you. We need to confirm first of all that indeed you are diabetic, and then we can intervene and then do something about it, so that if indeed it is diabetes, then we handle it appropriately, because indeed there's treatment available. We cannot cure it, you need to work hard on yourself to bring yourself to a point where you are no longer diabetic. I'll explain that shortly, but ultimately there's no cure for diabetes, especially the type 1 diabetes. Type 1 diabetes is usually an autoimmune issue. Your own body cells, for some reason which we can't explain, they identify your pancreas as foreign and they begin to attack the pancreas, right? So they destroy the cells in the pancreas that actually produce insulin. And so people who are type 1 diabetic tend to develop diabetes early. Usually by the age of 20, they have already developed the diabetes, and that diabetes is insulin dependent. So that's another name for type 2 diabetes, is insulin dependent diabetes. They literally thrive on insulin. Without insulin, they would not be alive, and so it's important that we understand that aspect. People with type 2 diabetes, on the other hand, have normal pancreas, or they've had normal pancreas, they were producing insulin normally. But because of certain things that they have exposed themselves to, chiefly being overweight, when you're overweight, or put this way, fat cells or fat resist insulin. So the insulin resistance I mentioned earlier is usually due to fat cells, and so the more fat cells you have, the higher the probability that you are going to develop insulin resistance. And so because of that insulin resistance, your body is unable to process the glucose, so that's why people with type 2 diabetes actually have more insulin in their blood. So if you tested their blood for insulin, you realize that they probably have higher than normal insulin, but unfortunately that insulin is not working effectively because of the insulin resistance. You could also have drug-induced diabetes. Some medication that you might take can affect either the insulin sensitivity or the pancreas and can cause it to develop diabetes. But this diabetes can be dealt with in most cases. Once you withdraw the drug, and the diabetes sort of gets you recover from that kind of diabetes, And then of course, pregnancy can also make a woman develop diabetes. It's called gestational diabetes. But this is also a kind of diabetes that after the pregnancy, it goes away. It's the effect of the placenta. The placenta produces hormones that inhibit insulin. But this makes sense because the placenta's job is to make sure that it mobilizes energy, nutrients for the baby, the developing baby, and so it produces insulin. It produces hormones that would prevent insulin from pushing the glucose into the mother's cells, so that the baby can have some of that glucose. Sometimes it overdoes it, and then the woman ends up developing diabetes. But once the baby is delivered and the placenta is removed, that diabetes would typically resolve by itself. Some women, unfortunately, would continue to develop diabetes fully after delivery of the baby, but most women would recover by themselves after that delivery. All right, so like I said, if you have any question, any feedback, do drop it in the comment section so I can respond to it. Those of us running on Twitter, you can retweet this, you can share this as well, and then invite others to join us so that we can learn together. This is definitely relevant medical information being broken down to the barest minimum so that everybody can understand it. And as a wellness consultant, I feel this is my job, because if you understand what's going on, it makes my life very, very easy. I mean, really. One of the things I never understand is why we doctors make things a bit complicated for people, you see, because if they don't understand what's going on, the probability that they are not going to follow the instruction is high. So I would prefer that we all understand what's going on, so that we work together hand in hand. Yes, it's your health. I'm the expert, right? And I'm telling you that this is what you need to do, because if you do this, this, and this, is going to get this and this effect, and then we will all be happy because the outcome is what we're actually looking for. When we have that understanding, I mean, my life is very, very easy. So that's why I do this, so that we can all understand why it's important to keep ourselves, And for the men, you should probably pay even closer attention, because indeed diabetes can make you impotent. Yes, it can make you impotent. So if you are a man and you're on this call right now, I urge you to actually go get your blood sugar tested, because it could be the source of all your problems, And the earlier we detect it, the earlier we can do something about it. Indeed, if you wait for the complication to be fully established, it tends to become permanent, and we don't want any permanent disability. So please take it seriously. and let's deal with it. So at least if I mean for today, we've learned why the symptoms of diabetes develop. We talked about polyphagia, we talked about polydipsia, which is the increased thirst. We talked about polyuria, which is the increased urination. Now there's one question I keep getting all the time whenever I discuss diabetes. Some people by themselves have decided to drink a lot of water, and so they tend to urinate a lot. Some people actually go to bed with a bottle of water by their bed, and they wake up in the night to drink that water. Personally, I don't know why you put yourself through that stress. I don't know why you put yourself through that stress, but if that's what you want to do, it's a choice. You can go ahead and do it. What I'll tell you is that if you are drinking a lot of water and you are sure that it is by choice, then it is possible that the urination you are urinating, the increased urination you are urinating, is just because of your decision to drink a lot of water. That's not what we are talking about. We are talking about those who drink water compulsively because they are actually thirsty. So if you have noticed a gradual increase in how much water you are drinking because you are consistently thirsty, then you need to go and get yourself evaluated. It could be that you are indeed diabetic. So that if you are diabetic, we can do something about it and prevent you from developing complications. Because for a lot of people, by the time we actually make the diagnosis of diabetes, they are indeed already developing complications. And that's why we want to make routine screening for diabetes a big part of our annual routines, so that every individual should actually get their sugar checked at least once every year. Ideally, it should be twice every year, but at least once a year, you need to go and get your blood sugar evaluated. And to get a blood sugar test done, you need to go in on an empty stomach. There are two tests that we can do. The first one that we would typically do would be a test called the fasting sugar. And for that test to be effective, you need to go in on an empty stomach after an 8-hour fast. So preferably your last meal should be about 6 p.m. the previous night. And then the next morning, you move from the house, and the first place you report to would be to the hospital, so that we can take that blood sample and then check the sugar. So it should be after an 8-hour fast. Now, the reason why we prefer an overnight fast is because when you are going about, let's say you woke up today at 8 a.m. and then you had your breakfast, you can still have an 8-hour fast and you skip lunch and then have the test done in the evening. But that test would not be accurate, because as you are going through your daily activities, as you go to work, as stress begins to build up, as you sit in traffic, your body releases certain hormones that are called stress hormones. And these stress hormones will generally mobilize sugar, right? When I say mobilize sugar, they prepare you to fight or to flee. So that's what stress hormones do. So when you are stressed, your stress hormones go up, and these are adrenaline and noradrenaline. And when they go up, they raise your sugar level. So even though you may not have eaten, right, your blood sugar would actually reflect your level of stress, not your diabetic situation. So you could end up being diagnosed as diabetic when indeed you are just stressed. This is important. And so it's better you do an overnight fast and then go first thing in the morning and have the test done. That will give you a more accurate result than taking a test at the end of the day. Because by that time, if you live in Accra like I do, when you move from your house, you start in Accra traffic and you get to the office, and then move from the office and get to the clinic, your stress hormones are through the roof. And so your blood sugar level will actually be stress induced and not necessarily because of diabetes. And it might end up costing you a lot, because you might end up being treated for diabetes when indeed you are not diabetic. So you need to do a fasting sugar in the morning. So overnight fast, your last meal 6 p.m. and then the test is done the next morning, and everything would be clearly demonstrated whether you are diabetic or not. So that's test number one. Then there's a second test, and when you do the fasting sugar, the cutoff is actually 7 millimoles per liter. So if your sugar is higher than 7, you are diabetic. If it's lower than 7, you might be there. If it's lower than 7, there are two interpretations. If it's less than 5.5, then you are in the normal range. But if it's between 5.5 and 7, you are pre-diabetic. But let me be quick to add, depending on which system the clinic is running, some people are diagnosed earlier. It could be 6.5 instead of 7, but 7 is pretty much standard across, right? So between 5.5 and 7, you are considered pre-diabetic. What pre-diabetes means is that you could end up developing diabetes, or you could end up not developing diabetes. You can go back to within the normal limit. It's all in your hands. What you do at that stage is dependent on you, right? But before I talk about pre-diabetes, let me talk about the next test, which is the HbA1c. Now, HbA1c is a test that gives us a wider window, whereas the FBS, or the fasting blood sugar, tells us today your blood sugar was high today. It doesn't really give us an information as to what the blood sugar was yesterday or 2 weeks ago, right? And so if your blood sugar is high today, that's the fasted blood sugar. But the HbA1c is able to give us a range of your blood sugar control over the past 3 months. Yes, over the past 90 days. And so it's a more of a confirmatory test, right? And it's also not an instant test. The FBS, you can do it right now. Within 2 minutes, you have your results, right? The HbA1c can take about a day to get the results. So typically, in most places, you would actually do the 2 tests simultaneously. So they will take the fasting sugar and they will take the HbA1c as well. So that the fasting sugar will tell us today, is this guy okay to go continue his work, and whilst we wait for the HbA1c results. If the FBS is normal, then you can go and continue your work whilst you wait for the HbA1c. So when the HbA1c comes in and it's also normal, then we know that you are not diabetic. You can go and then come back in a year to do the test again. But if the HbA1c comes in, let's say your FBS was normal, but the HbA1c is abnormal, it means that it is possible that because you actively or you consciously fasted overnight, that's why your blood sugar has come within normal limits. But under normal circumstances, your blood sugar is always out of control, and so you could be diabetic, and so we need to pay attention to you. Depending on the HbA1c level, it's also being graduated. So you have normal, you have pre-diabetic, and then you have diabetic. So depending on where you find yourself, then it could require an intervention or counseling or some lifestyle modification. Now, if you are pre-diabetic, like I said, you are not normal, you are also not diabetic, you are in between. At that point, we are not going to put you on medication. However, you need to be conscious of the fact that the probability of you tipping into diabetes is high. So you need to go through some modification of your lifestyle to ensure, or to at least minimize the probability that you are going to end up diabetic. So you need to begin watching your diet, because a diet that is high in processed foods is not so healthy, even though it's nice. I mean, speaking as a doctor, I'm conflicted because processed food is always nice, but indeed it is not as healthy as we ought to be eating, right? And so we need to cut down on processed foods and eat more of the less processed foods, right? So instead of eating white rice, you should be going towards the less polished brown rice. Instead of white sugar, you should be leaning towards the less polished brown sugar. Instead of white flour, you go towards brown flour. So these are some of the things you can begin to incorporate. And then also you need to avoid the table sugars, right? So you need more complex sugar. The reason why you need to avoid the table sugar is because the table sugar has been processed into its finest quality, which is pretty much almost near glucose. So if you took a drink of what's it called, soda or mineral, as we call it down here, soft drink, the speed with which that sugar is going to be absorbed is far faster than if you took a fruit juice or natural fruit juice, because the sugars in the natural fruit juice are complex, and so by the time the body breaks those sugars down, a lot of it will be lost, to inefficiencies. Machines have inefficiencies. The same way your digestion also has inefficiencies. And then because the fruit is also rich in roughages or fiber, the fiber also absorbs keeps a lot of the sugar in the stomach and is actually excreted. So all those are the reasons why fruits and vegetables must be a part of your diet if you are trying to, get a bit healthy. But the most important thing you can do for yourself is actually to lose weight. So after the diet, the next thing you need to check is physical activity. Improve your physical activity, your physical fitness. It makes a world of difference. In fact, for somebody who is pre-diabetic, if this person is able to lose 10 kilos of weight, if the person, so let me rephrase that. If somebody is diagnosed as pre-diabetic and this same person also is overweight, if you did the BMI and the person was overweight or obese, if that individual was able to lose 10 kilograms of his or her current weight, the blood sugar is likely to respond in a positive direction. So getting physically active is a major part of the lifestyle changes that you need to do if you are trying to prevent yourself from developing diabetes. Very important. And if you do this right, a lot of people are able to recover naturally without any medication. But unfortunately, some people will still progress to becoming diabetic and they would require medication. Now, if your doctor has diagnosed diabetes, you need medication. At the point where you are diagnosed as diabetic, that's not the point to now go and begin to now substitute the medication for the lifestyle changes. At that point, the lifestyle changes are part of the treatment, but the medication are also a major part, because the medications are there to prevent further deterioration of your systems, your eyes, your legs, in the case of the men, your penis. So the medication are there to prevent further damage, right? Whilst the lifestyle modification are going to try and reverse the sugar levels and the control the insulin levels as well. So it's a combination of the two. I attend to a lot of people who who do not want to start medication. I understand, because medication has side effects. I get all of those things, but the truth of the matter is that is why we are having this engagement today, because the best time to start putting in measures is right now. At the point when the diagnosis is made, we need to put your medication to prevent further damage, because it will be so sad for you to come in a couple of months or years later for an amputation because diabetes has taken your legs. So please, first of all, let's try to minimize the development of diabetes by screening and living healthier. That's number one. But if that fails and the diabetes is detected, the earlier intervention is started, the better the outcome. All right, so that's that. If there's any question at this point, I'm here. Let me address them quickly. So yes, so if everything I've said makes sense to you, can type it up in the comment section. If you have any feedback, please drop it in the comment section. Let's address it quickly as we begin to wrap up. Today we have been talking about diabetes and you in honor of World Diabetes Day, which is actually today. So today is World Diabetes Day, and so all over the world we are talking about diabetes, and that's why we are doing this as well. We're educating the world about diabetes, because diabetes is preventable. But if prevention fails, early detection is your next best bet, so that we can prevent the development of complications. So whilst we wait for questions, let me talk briefly about some of the complications. Now, because the blood sugar goes high, the sugar diffuses under the skin. And when the sugar goes under the skin, it creates a rich medium for bacteria to grow, such that if there's a cut on your leg or any part of your body, it gets infected quickly. So that's why people who are diabetic tend to have recurrent boils. So you have boils in your armpits, boils in your groin, recurrent urine infections. If you're a female, recurrent vaginal infections. People who are diabetic, they struggle with infection because the sugar slows down their immune system. So they can't fight infection as quickly as others would. So it's important that if you recognize that you are getting infection recurrently or repeatedly. In women, it's actually subtle, like vaginal discharge, candidiasis. You've had you are 30 years old. All of your life, you probably had candidiasis only once. Then suddenly, this year, you've had candidiasis like 3, 4, 5 times. That should draw your mind to something. Something is wrong. Something is not right. It could be that because diabetes is slow down immune system, that's why you're getting such recurrent infection. Same for a man. You've probably never had a UTI before as a man. You have never had a urine infection, which is likely. Then suddenly this year you've had 3. And you know that you have not been doing anything that should put you at risk of UTIs. That could be a sign that you have diabetes. So please go get yourself evaluated. Secondly, and this is why your legs are very important when it comes to diabetes. Every diabetic needs to have their leg examined every day. Every day. And preferably let someone else do the examination of your leg. And this is why. When the sugar is deposited under the skin of the legs, or under the skin generally, the legs suffer the most, because the legs are so far away from you, right? If you have sugar underneath your hand, the skin of your hand, and let's say you hurt your hand, you can see it. So your eyes compensate for the lack of pain, which I'm going to talk about. And so because of that, you don't get amputations of the hands often, because your eyes can see. But if you have a cut on your foot, you can't see it, And in the case of diabetes, they also cannot feel it because the sugar under the skin destroys the nerves. So they have no feeling. In fact, if you speak to diabetics, they'll tell you that when they are walking, they feel like they are walking on foam, like cushion, because they can't feel anything. They feel like they are walking on air. And that's diabetes that is very poorly controlled. We don't want you to get there. But should you get there, because the nerves are destroyed, you can't feel anything. If there's a cut under the leg, and with the sugar under the skin, the bacteria get in there, and the infection spreads so fast that there's nothing we can do other than to cut off that part of the leg. And if you delay, it spreads to another place, and you have to cut off that side as well. And so if you have somebody examine the leg every night, if there's a cut, they see it and they quickly respond, take it to the hospital. And you see, when a diabetic gets a cut on the leg, you don't treat it sitting in the house. No, you have to go to the hospital. It is that important. There's a whole category of, there's a diagnosis called diabetic foot ulcer. That's how important it is. It's a big deal. I almost failed an exam because of that, so I know what I'm talking about. So you have to go to the hospital and get yourself treated properly. It's even possible that because of that ulcer, if you were taking tablets to treat your diabetes, because of that ulcer, they might have to switch you from the tablet to an injection of insulin to help improve the sugar control, so that ulcer will heal. If the sugar control does not improve, the wound will not heal. If the wound does not heal, the infection will spread. If the infection spreads, we might have to cut off that leg. So please, this is a big deal. That's why I'm stressing it. So if you are diabetic, or if you have a diabetic in your family, please pay attention to their feet so that we can keep that foot. We don't want to lose it at all. Very important. And it's for the same reason why a man can also become impotent, because the sugar under the skin also happens in the penis as well. And because of that sugar being there, the nerves are going to die. And when the nerves die, there's no feeling in there. If there's no feeling, you cannot get an erection. If you cannot get an erection, that's impotence. And here's the thing, that kind of impotence is not reversible. So we don't want to get there. So if you are diabetic, take it seriously. Otherwise, it will take something that's important to you. All right. Faustina Tete, good to have you here. Thank you very much for the feedback. I don't see any questions on YouTube, and I don't see any new questions on Twitter either, which means I've either done a good job or I've confused everybody. But I think I've done a good job. If you agree with me, please drop a comment in the comment section. And remember, this recording will still be active. You can share it as well if it has been beneficial to you. Do share it with your friends and family. Share it on your status, on your social media, and subscribe to the channel as well. Let's build this health and wellness channel as we continue to live healthy and longer. Once again, I'm Dr. Kelvin, and I am your wellness consultant. Thank you very much for spending this hour with me. Well, it's not up to an hour, but you've been here with me together. So thank you very much for being here. Hope to see you on the flip side. Have a fabulous time until we meet again on the Wellness 360 with myself, Dr. Kelvin. I'm signing out. Okay, Marcus has a question. So what if you have itchy fingertips? Well, so a lot of diabetics also report pins and needles. So it's called pins and needles. Yes. Sometimes if you feel as if there are some pins and needles pricking your fingertips, your extremities. Extremities include your fingers, your toes. Yes, it could be a sign of diabetes. It could also be a sign of vitamin B deficiency. Ultimately, what I'll say is that you need to go in for a proper evaluation so that if it is indeed diabetes, we can deal with it promptly. So yes, go get evaluated. All right, thank you very much, guys. Have a fabulous time. Don't forget to subscribe to my channel, and let's build this together. Stay blessed. Peace.